Hello Isme. Today we will learn about monkeypox. Please comment. What is monkeypox? Why is it called monkeypox? According to experts, monkeypox was first detected in monkey in 1958. The first case in humans was recorded in 1970 in Congo. Monkeypox virus belongs to the genus Orthopox virus in the family Paxviridae. The disease, which is also related to smallpox, was eradicated in 1980, but with mild symptoms and a low mortality rate. The reason it is called monkeypox without any other name is because the disease was so originally discovered in 1958 when two outbreaks similar to smallpox occurred in monkey in a research laboratory. However, scientists say that monkey may not bear the cause of the outbreak, and the source of this disease is currently unknown. How to distinguish monkeypox and chickenpox when both have blisters on the skin? Accordingly, both confirmed and suspected cases need to be isolated at medical facilities. The guidelines state that monkeypox is an acute, potentially epidemic, infectious disease caused by the monkeypox virus. The disease is of African origin and is transmitted from animals to humans and from person to person through direct contact with skin lesions, bodily fluids, sexual contact, respiratory droplets, or human objects, infected and transmitted from mother to child. The main symptoms of the disease are fever, vesicular rash, and peripheral lymphadenopathy, which can cause serious complications leading to death. To understand more about the manifestation and severity of the disease, monkeypox is divided into 4 stages. Incubation period, from 6 to 13 days ranges from 5 to 21 days. Infected people have no symptoms and are not contagious. The onset phase, from 1 to 5 days with the main symptoms being fever and lymphadenopathy in the whole body. Accompanied by the patient may have headache, fatigue, chills, sore throat, muscle pain. The virus can spread to others from this state. Full-blown phase, characterized by the appearance of skin rashes, usually 1 to 3 days after fever, with the following characteristics. Location, rash tends to be centrifugal, more common on the face, palms, shoulders. The rash may also appear on the mouth, eyes, and genitals. Rash progression, sequentially from maculated lesions with a flat base, to papules slightly red lesions, then to vesicles clear fluid-filled lesions, pus to less yellow fluid-filled lesions, scabs dry, pin and mild scars. Size of skin lesions vary from 0.51 cm. The number of skin lesions per person can range from few nodules to dense. In severe cases, the lesions may coalesce into large patches of skin lesions. Recovery phase, symptoms of monkeypox can last 2 to 4 weeks and then go away on their own. The patient has no clinical symptoms. The scars on the skin can affect the aesthetics and there is no risk of infecting others. The disease is divided into 3 clinical types. Asymptomatic form, people infected with monkeypox virus do not have any clinical symptoms. Mild form, symptoms usually resolve after 2 to 4 weeks without any specific treatment. Severe form, common in high-risk groups, pregnant women, the elderly, children. People with underlying diseases, immunocompromised, can lead to death, usually from week 2 of the disease. Patients may experience skin infections, with prolonged fever, cloudy blister fluid or broken blisters with cloudy fluid. Some may develop pneumonia, cough, chest tightness, difficulty breathing, encephalitis, decreased consciousness, convulsions, confusion, coma, sepsis, persistent fever, damage to internal organs. According to the guidelines, monkeypox is diagnosed by molecular biology testing, PCR or equivalent of oropharyngeal swabs. Initiation phase, nodular exudate, full-blown state for cases of rheumatic fever. Suspected disease to determine the cause. Any suspected case of monkeypox within 21 days prior to symptom onset, contact with a confirmed or probable case of illness, through direct physical contact with the skin or a skin lesion, including sexual contact, or come into contact with contaminated items such as the patient's clothing, bedding, and personal belongings. A history of travel to countries where monkeypox is endemic within the 21 days prior to symptom onset. The confirmed case occurred with apparative molecular biology test result for monkeypox virus. Based on symptoms of fever, rash, and lymphadenopathy, the diagnosis of monkeypox should be differentiated from smallpox, chickenpox, disseminated heifer, and hand, foot and mouth disease. According to the guidelines, suspected and confirmed cases are isolated at medical facilities. The treatment is divided into 2 types. Mild form, symptomatic treatment is the mainstay, fever, pain relief, care for skin, eye, mouth lesions, nutrition, electrolyte balance, monitoring and early detection of complications, if any. Infection prevention and control as prescribed. Severe form, need to be treated in an isolation room in the intensive care unit, treat complications if any according to the issued protocol. The use of specific treatment drugs is indicated for people with severe complications, bacemia, pneumonia, encephalitis, immunocompromised people HIV, cancer, being treated with immunosuppressive drugs. Fluids or high-dose corticosteroids, children, pregnant or lactating women, people with active acute illness. How is monkeypox treated? According to the guidance of the Ministry of Health, the treatment of the disease will be classified according to the disease type. At the Cam Watson District Health Center, we treat asymptomatic cases, mild cases with common symptoms of the disease. Provincial and central levels, we receive cases of severe disease or at risk of exacerbation, newborns, immunocompromised people, elderly people, underlying diseases, pregnant women, cases with severe complications. Danger size of the disease need to be monitored, consider referral for treatment, decreased vision, decreased consciousness, coma, convulsions, respiratory failure, bleeding, decreased urine output and size of infection bacemia and septic shock. Patients WHO are isolated for at least 14 days without clinical symptoms.